Namaste, my friends, and welcome to your mats. Today, we are talking about the rotator cuff. In the shoulder, it can be an extremely painful situation that we have in the shoulder, which can actually lead to a little bit more restriction of movement because it becomes so painful in the shoulder area. So we don't want to miss out on our practice, but we definitely need to modify some poses to help our body give the opportunity to heal. I'm a big believer that when it comes to dealing with a complaint or an injury in our body, there's a fine line between overstretching and restriction. And what I mean by that is that we don't want to hold the body. If it's in pain, we don't want to hold it and restrict it. And we definitely want to nurture it, but we definitely need movement because movement will help reduce the inflammation in the space. But then we don't want to over move it or overstretch it. So we've got to meet in the middle. If you find that there is pressure in the area, then only go as far as before you can feel pressure. Okay, so if you're feeling, okay, I can feel that stretch and I can feel that pull, and you've got an injury, that's one step too far. So just come under that line a little bit there. Let's first start with how to prevent our shoulder from having those kind of injuries, or if you are feeling something coming along, how to actually give it a little bit more of a relaxed atmosphere without missing out on your yoga practice. So let's have a little look at the poses of plank, downward dog. They are poses that are going to put a lot of pressure onto the shoulder space. So the first thing that we're going to do, if this is the pose that they come to in your practice, then we simply drop your knees down to the floor. That is step one. All of a sudden you're taking the pressure off. Same as if we're in a downward dog. Straight away, instead of coming to this pose for the class, just modify it by dropping the knees down. The second thing we want to do is, instead of stacking the shoulders over the wrist, bring your body back slightly. So all of a sudden your fingertips and your hands are a little lighter, and it softens up the shoulder and softens up the area through the shoulder. So it's giving less pressure. So those are some modifications that we can use. Now let's come into a couple of gentle stretches to actually help with that fine line of movement that we spoke about. So from here, just draw the legs, knees out, bring yourself down onto your belly, and we're going to draw the hands next to the chest rather than out in front. So straight away, even with a Sphinx pose, that's going to change that pressure. And then from here, draw the right hand, or whatever hand you want to stretch first, over to the left. So you're drawing that line underneath, and then we stretch the other arm out in front. I would suggest to stay here anywhere from 2 to 5 minutes, depending on how it feels for you. So what we're doing is we're actually putting a little bit of pressure on that space as well. So staying here for that time frame, and make sure that you do both sides, even though one side may be a little bit more troublesome. Then you're going to that's what you want to focus on. Make sure you just do the other side as well, because then it evens the body out. And then unfold. And just another gentle pose. So the idea of being on your body like that is we're putting a little bit of pressure onto the stretch. Alternatively, we can just bring the arm across like so, which is a really nice stretch. It's a lot more gentle and a lot more nourishing. So giving you some little ideas just to help with that. We do want to make sure that you work in giving the body movement. Your body needs movement to heal. It needs circulation to heal. And if you have any more questions, please send them through. Namaste, my friends.